Good evening, ladies and gentlemen. Thank you for joining us tonight for this crucial debate on the topic of whether tobacco and alcohol regulation should fall under the supervision of the FDA, the Food and Drug Administration. As the moderator for tonight's event, I will ensure that this debate remains focused, respectful, and enlightening. Our first speaker, Jane, will present arguments in favor of incorporating tobacco and alcohol regulation under the FDA. Following Jane, Adam will provide counterarguments against such a notion. So please join me in welcoming Jane as she begins her opening statements.
Ladies and gentlemen, today I stand before you to affirm that tobacco and alcohol regulation should be under the jurisdiction of the Food and Drug Administration, FDA. The FDA is an established federal agency responsible for protecting public health by ensuring the safety, efficacy, and security of a wide range of products, including drugs, cosmetics, and food. It is only logical to extend its oversight to these harmful substances as well. Throughout this debate, I will present compelling arguments and provide evidence supporting the need for FDA regulation of tobacco and alcohol. Firstly, by placing tobacco and alcohol regulation under the FDA, we can leverage the agency's expertise in public health and scientific research. The FDA has a long-standing history of evaluating and approving drugs, conducting safety assessments, and implementing regulations based on empirical evidence. Applying this expertise to tobacco and alcohol would enable the establishment of evidence-based policies that prioritize public health. For example, the FDA could create comprehensive warning labels on alcoholic beverages to inform consumers of the risks associated with excessive alcohol consumption. Additionally, they could require tobacco companies to disclose the harmful chemicals present in their products, empowering consumers to make informed decisions. Secondly, FDA regulation of tobacco and alcohol would enhance consumer protection. The FDA has a track record of implementing robust regulations that ensure the safety and quality of products. By subjecting tobacco and alcohol to the same stringent regulatory standards that other consumer products adhere to, we can reduce the prevalence of counterfeit and dangerous substances. This would protect consumers from the potential health hazards posed by low-quality or contaminated tobacco and alcohol products. Furthermore, FDA oversight would enable more effective monitoring of advertising and marketing practices, curbing misleading claims that entice vulnerable populations, such as youth, to use these substances. Moreover, FDA regulation can facilitate better control over addictive substances. Tobacco and alcohol are known to be highly addictive and can lead to severe health consequences. By placing them under FDA jurisdiction, we can implement stricter measures to prevent addiction and promote public health. The FDA could, for instance, restrict or ban certain additives or ingredients that amplify the addictive properties of these substances. This would mitigate the health and social burden associated with addiction, such as increased healthcare costs and lost productivity. Lastly, FDA regulation would foster uniformity and consistency in tobacco and alcohol policies across the country. Currently, the regulations governing these substances vary from state to state, leading to a patchwork of different standards. By centralizing the regulatory oversight under the FDA, we can establish coherent and consistent guidelines that apply nationwide. This would alleviate confusion, simplify compliance for businesses, and promote a unified approach to protecting public health. In conclusion, placing tobacco and alcohol regulation under the FDA is a logical step towards safeguarding public health, enhancing consumer protection, and ensuring the control of addictive substances. By leveraging the FDA's expertise, implementing robust regulations, and promoting uniformity, we can work towards reducing the harmful effects of tobacco and alcohol on individuals and society as a whole. It is time for our nation to prioritize public health, and establishing FDA regulation is a critical step in that direction. Thank you.
Ladies and gentlemen, today I stand before you to argue against the proposition that tobacco and alcohol regulation should be under the jurisdiction of the FDA. While I understand the importance of regulating these substances, I firmly believe that the responsibility of regulating tobacco and alcohol should not be entrusted to the Food and Drug Administration. First and foremost, it's important to recognize that the FDA's main focus is on ensuring the safety and efficacy of food and drugs. Placing tobacco and alcohol regulation under the FDA's purview would dilute their capacity to adequately fulfill their primary responsibilities. This could potentially lead to neglect or decreased focus on critical matters concerning food and drug safety, which are already vast and challenging areas to regulate. Moreover, it is essential to highlight that tobacco and alcohol have unique characteristics that set them apart from traditional food and drugs. Unlike food and drugs, which are generally consumed for nourishment or medical purposes, tobacco and alcohol are products that, when used responsibly, may offer recreational benefits. Placing these substances under the FDA's umbrella might lead to overly stringent regulations that impede responsible adult consumers' freedom of choice and limit their enjoyment. Additionally, the FDA has limited resources and expertise to address the complexities of alcohol and tobacco regulation. The tobacco industry, for instance, has a long history of advocacy and legal battles, backed by substantial financial resources. Transferring regulation to the FDA could create a large bureaucratic burden and potentially hinder the agency's ability to effectively monitor and enforce regulations. Furthermore, there are existing entities in place that are better equipped to regulate tobacco and alcohol. For instance, the Alcohol and Tobacco Tax and Trade Bureau, TTB, already has the expertise and experience in regulating and taxing alcohol in the United States. TTB's focus solely on alcohol allows them to specialize and tailor their strategies efficiently, ensuring the industry is adequately regulated without burdening other sectors. Lastly, excessive regulations on tobacco and alcohol can have unintended consequences, such as fostering a black market or underground trade. History has shown that excessive government control and prohibition measures often lead to the emergence of illicit markets, fueling criminal activities and endangering public safety. It is crucial to strike a balance between regulation, education, and personal responsibility, rather than resorting to heavy-handed government intervention. In summary, the FDA should not be responsible for the regulation of tobacco and alcohol. Their core mandate is to ensure the safety and efficacy of food and drugs, and expanding their jurisdiction to encompass these substances risks diluting their effectiveness in their primary area of focus. Moreover, alcohol and tobacco have unique characteristics that set them apart from traditional FDA-regulated products, making it more appropriate for specialized agencies such as the TTB to handle their regulation and taxation. Let us prioritize responsible regulation that respects personal freedom and individual choice, rather than burdening the FDA and potentially fostering unintended consequences. Thank you.
Thanks for the openings, Jane and Adam. Please continue with your rebuttals.
While my opponent raises valid concerns, it is important to consider the potential benefits and strengths of FDA regulation of tobacco and alcohol. Regarding their first point about diluting the FDA's capacity to ensure food and drug safety, it is worth noting that many countries, such as Canada and Australia, have successfully entrusted their regulatory bodies with oversight of tobacco and alcohol without compromising on food and drug safety. Furthermore, regarding their assertion that tobacco and alcohol have unique characteristics, we must remember that the FDA is well-versed in handling substances with varying properties. They have successfully regulated addictive substances like opioids and stimulants, exemplifying their ability to adapt to different product categories. Additionally, my opponent mentions the Alcohol and Tobacco Tax and Trade Bureau, TTB, as a suitable alternative to FDA regulation of alcohol. However, it is important to note that the TTB's primary focus is on tax collection, not public health. The FDA, on the other hand, has the necessary expertise to consider the broader implications of alcohol use, including its effects on public health and safety. Finally, while the concern over increased government control leading to a black market is valid, history has shown that regulation and oversight can effectively limit the size and impact of illicit markets. Countries with stringent tobacco and alcohol regulations, such as Australia, have successfully minimized the illegal trade through comprehensive measures. In conclusion, by leveraging the FDA's expertise, we can implement evidence-based regulations, enhance consumer protection, and promote public health. Placing tobacco and alcohol regulation under the FDA is a logical step towards protecting individuals from the harmful effects of these substances. Thank you.
In response to Jane's points, while it is true that some countries have entrusted their regulatory bodies with oversight of tobacco and alcohol, it is important to consider the specific circumstances and regulatory frameworks of each country. Comparing the regulatory success of other countries does not necessarily translate to the effectiveness of FDA regulation in the United States, which has its own unique challenges and complexities. Regarding the FDA's experience in regulating addictive substances, it must be acknowledged that tobacco and alcohol addiction are widespread and pose distinct challenges. According to the Centers for Disease Control and Prevention, CDC, alcohol and tobacco use are the leading causes of preventable diseases, deaths, and disabilities in the United States. These staggering statistics highlight the need for specialized agencies with a deep understanding of the unique challenges presented by tobacco and alcohol use. While the TTB's primary focus may be tax collection, it does not discount their role in regulating alcohol. The TTB has the expertise and experience to effectively regulate the alcohol industry, as evidenced by their successful oversight of labeling, advertising, and product safety in relation to alcohol. Furthermore, history has shown that prohibiting or heavily regulating goods with high demand often leads to the development of black markets. For example, during the Prohibition era in the United States, the illegal alcohol market thrived, giving rise to organized crime. It is crucial to learn from history and adopt pragmatic regulatory approaches that do not inadvertently create additional social and criminal problems. In conclusion, while I respect Jane's perspective on FDA regulation, it is important to consider the unique challenges associated with tobacco and alcohol regulation. The FDA's primary mandate is to ensure the safety and efficacy of food and drugs, and expanding their jurisdiction to include these substances risks diverting their attention from their core responsibilities. Specialized agencies, like the TTB, with specific expertise and experience should continue overseeing the regulation of tobacco and alcohol to ensure the best outcome for public health and safety. Thank you.
Let's get into open discussion.
Adam, I appreciate your points. However, the FDA's ability to regulate addictive substances has been well established through its regulation of opioids and stimulants, demonstrating its capacity to adapt to different product categories. Can you provide evidence to support your assertion that the FDA would be ill-equipped to handle the specific challenges presented by tobacco and alcohol addiction?
While the FDA has experience in regulating addictive substances such as opioids and stimulants, it is important to note that tobacco and alcohol addiction present unique challenges. According to a study published in the journal Addiction, the addictive nature of alcohol is distinct from other substances, making it crucial to have specialized expertise in regulating its use. Similarly, the National Institute on Drug Abuse states that tobacco addiction is one of the hardest addictions to overcome, requiring tailored interventions that may not align with the FDA's primary focus on food and drugs.
Adam, I appreciate your response. However, while tobacco and alcohol addiction may present unique challenges, it is important to note that the FDA has already shown its ability to regulate addictive substances effectively. For example, the FDA has implemented successful regulations on nicotine-containing products, such as e-cigarettes. Can you provide any evidence or alternative solutions that would ensure comprehensive oversight of tobacco and alcohol, considering the FDA's existing expertise in regulating addictive substances?
Certainly, Jane. While the FDA has regulated nicotine-containing products and e-cigarettes, it is important to acknowledge that these regulations remain a contentious issue. According to a study in the journal Tobacco Control, there are concerns about the efficacy and enforcement of these regulations. Instead of placing the burden solely on the FDA, alternative solutions could involve collaboration with specialized agencies like the TTB to ensure comprehensive oversight while leveraging their respective expertise in tobacco and alcohol regulation. Jane, I understand your points regarding the FDA's ability to regulate addictive substances. However, considering the unique challenges presented by tobacco and alcohol addiction, can you provide evidence or studies that specifically demonstrate the FDA's effectiveness in addressing the complexities of these substances?
Adam, I appreciate your request for evidence of the FDA's effectiveness in addressing the complexities of tobacco and alcohol addiction. According to a study published in the American Journal of Public Health, FDA regulations, such as graphic warning labels on cigarette packages, have been found to increase public awareness of the health risks associated with tobacco use. Additionally, a study published in the Journal of Studies on Alcohol and Drugs found that policies implemented by the FDA, such as alcohol advertising restrictions, have contributed to a decrease in alcohol-related motor vehicle fatalities. These studies demonstrate the FDA's capacity to effectively regulate and address the complexities of tobacco and alcohol addiction.
Jane, I appreciate your response. However, can you provide specific evidence or studies that demonstrate the FDA's ability to effectively address the unique challenges of tobacco and alcohol addiction beyond its regulation of nicotine-containing products like e-cigarettes?
Adam, I apologize for any confusion. The FDA's effectiveness in addressing tobacco and alcohol addiction goes beyond its regulation of nicotine-containing products. According to a study published in the American Journal of Preventive Medicine, FDA regulations, such as reducing nicotine levels in cigarettes, have the potential to significantly decrease smoking rates and tobacco addiction. Additionally, the FDA's efforts to enforce marketing regulations on alcohol, such as restrictions on labels and advertisements targeting minors, have shown positive effects in curbing underage drinking, as highlighted by a study published in the Journal of Youth and Adolescence. These studies provide evidence of the FDA's ability to address the unique challenges of tobacco and alcohol addiction through comprehensive regulatory measures.
Great debate. Please wrap up and argue your closings.
Thank you, moderator. Throughout this debate, I have presented compelling evidence supporting the need for FDA regulation of tobacco and alcohol. While my opponent questions the FDA's ability to effectively address the unique challenges of addiction, numerous studies demonstrate the agency's effectiveness in regulating these substances. For instance, a study published in the American Journal of Preventive Medicine found that the FDA's efforts to reduce nicotine levels in cigarettes have the potential to significantly decrease smoking rates and tobacco addiction. Additionally, strict regulations on alcohol marketing, enforced by the FDA, have been shown to curb underage drinking, as highlighted in a study published in the Journal of Youth and Adolescence. Moreover, the FDA has consistently demonstrated its capability to adapt and regulate substances with unique characteristics. Its successful oversight of addictive substances like opioids and stimulants serves as a testament to its expertise in handling varying product categories. In conclusion, entrusting tobacco and alcohol regulation to the FDA is a logical and necessary step to protect public health, enhance consumer protection, and control addictive substances. With its established track record in regulating addictive substances, its ability to formulate evidence-based policies, and its commitment to public health, the FDA is well suited to assume this vital responsibility. Quoting Dr. Margaret Hamburg, former commissioner of the FDA continues to be the gold standard for regulating the safety and effectiveness of medical products, and there is no reason why it cannot do the same for tobacco and alcohol. It is time to prioritize the well-being of individuals and ensure comprehensive oversight of these substances. I urge you to support FDA regulation of tobacco and alcohol for the betterment of our society. Thank you.
Thank you, moderator. Throughout this debate, I have argued against placing tobacco and alcohol regulation under the FDA's jurisdiction. While my opponent has presented some evidence supporting FDA regulation, it is essential to carefully consider the potential drawbacks and question whether the FDA is the most suitable regulatory body for these substances. We must prioritize the FDA's core responsibilities of ensuring the safety and efficacy of food and drugs, which already require significant resources and expertise. Expanding their jurisdiction to encompass tobacco and alcohol could divert attention and resources away from these crucial areas. Alternative regulatory bodies like the Alcohol and Tobacco Tax and Trade Bureau, TTB, already possess the necessary expertise and specialization in these substances. We should leverage their existing capabilities and knowledge to ensure comprehensive oversight without overburdening the FDA. Moreover, excessive regulation and heavy-handed government intervention can unintentionally lead to unintended consequences, such as the emergence of black markets and the restriction of personal freedom and choice. It is important to strike a balance between regulation, education, and personal responsibility to address the challenges posed by tobacco and alcohol use effectively. In closing, I would like to iterate that while the goal of safeguarding public health and mitigating the harms associated with tobacco and alcohol use is crucial, entrusting the FDA with the regulation of these substances poses risks to their core responsibilities, personal freedom, and potential unintended consequences. Let us find a balanced approach that leverages the expertise of specialized agencies while respecting individual autonomy and promoting responsible consumption. Thank you.
Thanks, everyone. Let's have a few questions. Adam, thank you for your insightful arguments against placing tobacco and alcohol regulation under the FDA. You mentioned that the FDA's primary focus should be on food and drug safety, and expanding their jurisdiction might dilute their effectiveness in that area. Considering the potential harms associated with tobacco and alcohol consumption, do you believe that a specialized agency solely dedicated to regulating these substances, similar to the TTB, could adequately address their unique characteristics and promote public health effectively?
Yes, I believe that a specialized agency like the TTB, dedicated solely to regulating tobacco and alcohol, could effectively address the unique characteristics of these substances and promote public health. Such an agency would have the expertise, resources, and focus necessary to develop targeted regulations that specifically address the challenges presented by tobacco and alcohol use.
Jane, you mentioned that the FDA has successfully regulated addictive substances like opioids and stimulants, showcasing their adaptability across different product categories. However, tobacco and alcohol addiction present unique challenges, including societal and cultural acceptance, long-standing industry practices, and complex consumer behaviors. How do you propose that the FDA, if given jurisdiction over tobacco and alcohol, would address these unique challenges in a way that effectively curbs addiction and promotes public health?
Thank you for your question, moderator. If given jurisdiction over tobacco and alcohol, the FDA can address the unique challenges of addiction through a multifaceted approach. This would involve implementing evidence-based regulations, conducting public awareness campaigns, fostering partnerships with public health organizations and industry stakeholders, and continually monitoring and updating policies to adapt to evolving societal and cultural norms surrounding tobacco and alcohol use.
Adam, you requested specific evidence or studies showcasing the FDA's ability to effectively address the unique challenges of tobacco and alcohol addiction beyond its regulation of nicotine-containing products. While there may be limited studies directly assessing the FDA's role in this aspect, can you suggest alternative approaches or strategies that you believe could be effective in combating tobacco and alcohol addiction, regardless of the regulating body involved?
Certainly, alternative approaches to combating tobacco and alcohol addiction could include comprehensive public education campaigns, increasing access to evidence-based treatment programs, implementing strict advertising and marketing regulations, and promoting responsible consumption through taxation and pricing strategies. These strategies, regardless of the regulating body involved, have shown promise in addressing addiction and promoting public health.
Thank you, ladies and gentlemen, for your participation in this engaging debate on whether tobacco and alcohol regulation should fall under the jurisdiction of the FDA. Both Jane and Adam presented thought-provoking arguments, backed by evidence and logical reasoning. Upon reviewing the arguments presented, it is clear that Adam presented a compelling case against placing tobacco and alcohol regulation under the FDA. He emphasized the FDA's primary focus on food and drug safety, the unique characteristics of tobacco and alcohol, the limited resources and expertise of the FDA, and the presence of specialized agencies such as the TTB. Adam effectively addressed concerns about potential dilution of the FDA's core responsibilities and emphasized the importance of maintaining personal freedom and responsibility. Though Jane provided valuable insights and evidence supporting FDA regulation, she faced challenges in directly addressing Adam's concerns about the FDA's capacity to effectively address the unique challenges of tobacco and alcohol addiction beyond its regulation of nicotine-containing products. Additionally, further elaboration on potential collaboration and comprehensive strategies to address addiction issues could have strengthened her arguments. Taking into account the arguments put forth, I am pleased to announce that Adam has earned 1 point, while Jane has not secured any points. Therefore, Adam emerges as the winner of this debate by a margin of 1 point. In conclusion, it is crucial to recognize that this debate serves as a platform for nuanced discussions on the role of the FDA in regulating tobacco and alcohol. Both speakers presented valuable perspectives, fostering a greater understanding of the complexities involved. Whether or not tobacco and alcohol regulation should be under the FDA remains a topic open to ongoing exploration and further examination. Thank you once again for your participation and insight in this important debate.